Most mothers remember the feeling of finally getting to hold their newborn after hours of grueling labor, taking in the first moments of physical touch with their child, a wish they've had for 9 months finally coming true. But some moms are forced to forgo that important moment. Letitia Wilborn was only allowed a glimpse of her daughter Bella before nurses whisked the baby away for tests and procedures.
I had her a week before my due date. It was so many people in the room with us, and they just swift her away, ran all kinds of tests on her. I didn't see Bella. Bella was born at about 10 o'clock in the morning. I didn't see Bella till about 8 o'clock that night. So you know how most people, they get to see their baby right away. They get to bond with their kid. That wasn't the case with me.
Wilborn's daughter was born with a congenital heart condition called Tetralogy of Fallot, or TOF, also known as blue baby syndrome.
It is associated with really a series of problems within the heart, including a hole in the bottom part of the heart, typically narrowing of the pulmonary valve, or a narrowing of the way that blood gets from the heart out to the lungs, as well as thickening of the right side of the heart.
That's Dr. Jeff Zampi, Associate Professor of Pediatric Cardiology at the University of Michigan and Director of Interventional Pediatric Cardiology at C.S. Mott Children's Hospital. He says most kids with TOF will need some type of heart repair within the first few months of life. As for Bella, she needed a cardiac catheterization procedure right after birth. Following surgery, she spent a week in the newborn intensive care unit before Wilborn could finally take her home.
It's really a lot to deal with. You have to be really strong to be able to deal with something like this, to see your child with all those tubes and cords and never know what's going to happen. So I probably do have a little bit of PTSD, because every time I know an appointment is coming up, I get really anxious and really worried and nervous. But I believe in prayer, so I pray to God, and everything's been okay so far.
Wilborn was aware that her child had a serious heart condition before she gave birth. She found out at the highly anticipated 20-week ultrasound appointment.
They automatically gave me pamphlets and was like, if you want to abort her. They automatically asked me if I wanted to have an abortion, because they knew what type of life she would have. They knew it would be difficult. And, some people are just not able to deal with that.
Despite the challenges, she decided to move forward with the pregnancy. After Bella's initial catheterization at birth, she didn't have her first open-heart surgery until she was 3.5 months old. Bella had her next heart operation at 8 months, and then a third when she was 18 months old. However, Zampi says that most children with TOF will need only one major surgery around the 4 to 6 month mark.
But usually with that operation, they're left with severe pulmonary insufficiency, basically meaning that the valve that connects their right ventricle to their pulmonary arteries, so the way that they get blood from their heart out to their lungs, that valve is typically taken out or partially removed at the time of the surgery, so that they then are left with free leakage across the valve. So what that does over time is that their right ventricle starts to enlarge, and the function can start to go down in their right ventricle. So we expect that most patients with Tetralogy of Fallot will need some type of pulmonary valve replacement at some point in their life, usually in their 20s, 30s, or 40s.
Zampi estimates that most valves last about 10 to 20 years in patients. The standard procedure requires open-heart surgery, but 2 new types of valves are able to fix the problem with a cardiac catheterization procedure.
In essence, they're both what we call self-expanding valves, meaning that the valve will kind of fill up the space of where the pulmonary valve should be. So that's different than some of our other valves that we use in patients with Tetralogy of Fallot, or other patients that have right ventricular outflow tract disease that are what's called balloon expandable, means that it's a metal that we expand into place using a balloon. These are self-expanding, meaning they kind of open up and fill the space to take up all that large amount of room that's in the outflow tract.
The catheters for the new valves are inserted through the leg and then travel to the heart, where doctors implant the self-expanding valve.
So the beauty about this procedure is that you don't have to have another sternotomy, which is the incision on the part of the chest. You don't have to have your chest wall opened. And more importantly, you don't have to go on to cardiopulmonary bypass or an open heart operation to fix the valve. And so for a lot of people, we expect that this will replace at least one and maybe more of those surgeries that they'd have over the course of their lifetime. And actually, for some people, we're hopeful this may mean that they never have to have another heart operation again.
Zampi says patients get a CT scan beforehand to see which valve they're a candidate for. After that, the procedure takes about 2 hours.
Patients stay one night in the hospital, they go home the next day. They're back to work as early as the day after that. So for many of these people, we're talking about normally an open heart operation. You would expect to be in the ICU for at least 1 day, probably in the hospital for 3 to 7 days, and off work for several weeks. Whereas these people are going to be back to their normal routine of back at work, certainly within a week.
Before this procedure, Zampi estimates only 30% of patients were able to use catheterization procedures. These new valves now give up to 80% of patients this treatment option.
So, that's not 100% of people, but that's a lot of people that we can keep out of the operating room. The other thing that's important is that, we don't kid ourselves in thinking that this valve is going to work for everybody. And we also don't promise that a patient will never have to have surgery again. And I think that's important. This is meant to be part of the overall care plan of a patient, lifelong care plan of a patient with Tetralogy of Fallot. So while our goal is always to limit the number of surgeries they have to make their quality of life better, we know that we work very closely with our surgeons to always deciding, the risk-benefit alternative of a procedure like this versus a surgical procedure. And some patients are actually better candidates for surgery. So while we're very excited about this, it's certainly not the end. We expect a lot more innovation from companies and valves coming out that are happening outside the United States, some of which will probably come inside the United States. But our hope is someday that thinking about pulmonary valve replacement really becomes that surgery is something that is really reserved for the very minority of patients with this type of problem.
An exciting feature, especially when not too long ago treatment options were limited. Until the 1940s, TOF was usually a death sentence for babies born with a condition. 3 people, Dr. Alfred Blaylock, Dr. Helen Taussig, and Vivian Thomas, are credited with creating the life-saving surgery at Johns Hopkins University.
Our heart center here is called the Blaylock, Taussig, Thomas Pediatric and Congenital Heart Center. So to give respect to all of those people who were in the history of congenital heart surgery at Hopkins. Vivian Thomas is super well known at Johns Hopkins. There are commemorative portraits and plaques and things around the institution.
That's Dr. Danielle Gottlieb-Sinn, a pediatric cardiac surgeon and assistant professor of surgery at Johns Hopkins. She says today Thomas is widely considered a legend in the congenital cardiac field. However, that wasn't always the case. Thomas was a black man during the height of segregation. Newly graduated from high school, his college plans were put on hold by the Great Depression. He got a job as Blaylock's laboratory assistant, where he learned various surgical techniques. By the mid-1930s, Thomas was doing the work of a postdoctoral researcher, but was officially classified and paid as a school janitor.
Clearly, he had great aptitude and had a really tremendous work ethic, and so practiced, focused, deliberately repeated what he was trying to accomplish until the time when his skills were honed and he was able to teach or to share what he knew to have a successful outcome.
In 1943, Taussig paid a visit to Blaylock, hoping he could find a cure for TOF. He handed the project over to Thomas, who began his research on dogs. Thomas would recreate the condition in these canines and then test potential solutions.
It was a time where animal research was very prevalent, and a lot of surgical research was done on large animals. And so at the time, that's the kind of research that they were doing. And apparently, Vivian Thomas, the way the stories go, is that he was a tremendous technician, a great technical surgeon.
After nearly 200 dogs, Thomas had found the solution that would go on to save thousands of children. During the first human procedure, he stood on a stool in the operating room behind Blaylock, instructing the doctor how to perform the surgery. But when the operation was recognized in the Journal of the American Medical Association, Blaylock and Taussig received sole credit, Thomas's part seemingly left out of history.
Vivian Thomas entered Johns Hopkins through a different door than Alfred Blaylock did. And I think that is important to acknowledge, that despite the segregation of the time, that Vivian Thomas had an enormous impact on surgical subspecialty and an enormous impact on patients that has long exceeded his lifespan and is something to really be honored.
Thomas continued working under Blaylock and training young surgeons at Johns Hopkins. He became the director of surgical research laboratories, and in 1976 the university awarded Thomas an honorary doctorate. However, restrictions at the time allowed him only to receive an honorary doctor of laws instead of a medical doctorate. He was also appointed to the faculty of Johns Hopkins Medical School as an instructor of surgery until his retirement in 1979. Gottlieb thinks the unlikely team of Thomas, Blaylock, and Taussig should be a model for future advancements.
And Alfred Blaylock was, sort of in a position of power and someone who had been technically trained to be a surgeon and had the ability to influence the environment. And Helen Taussig, from all accounts, was a very creative person and sort of had this deep knowledge of physiology. And Vivian Thomas had the technical expertise to develop the techniques. And so that's a really tremendous example of how innovation happens in multidisciplinary teams.
Without the work of Thomas, toddlers like Bella would not be alive today. Wilborn's book, A Heart Like Bella's, is available now. You can find more information about Dr. Jeff Zampi, Dr. Daniel Gottlieb Sin, and Letitia Wilborn on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
Our primary care physicians are not trained to diagnose psychiatric disorders. They have very little training. It's essentially the equivalent of binging on a couple of seasons of Grey's Anatomy.
A woman's journey through 6 mental health misdiagnoses.
Then how much can we really learn from animal studies?
You're asking the question, how well does a mouse really reflect the human, right? That's really what you're after. And really, that depends on the disease itself.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We are social beings, and we build our sense of self in community with other people.
The deepening mental health crisis in adolescence. Then,
on average, annually, diamond exports are about $3 billion a year from Russia.
A look at the diamond trade that's fueling Russia's invasion of Ukraine. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.